The first thing you want to do before working out is to get warm. First, Sarah's getting her heart rate up on the treadmill with a small jog, progressing into a faster run. Now Keely is demonstrating the forward leg swing. This dynamic stretch warms up and stretches the hip joint. Be sure to keep your pelvis straight throughout the entire movement. Sarah is demonstrating a dynamic hip flexor stretch, which targets the muscles in the abdomen, glutes, and pelvis. This forward back motion specifically warms up the glutes and stretches the entire leg. For warming up the chest, Gigi is performing a circumduction of the arms. This gets the blood pumping in your chest, shoulders, triceps, and biceps. First, for the legs, we have the front squat. This mainly occurs on the horizontal axis and the medial plane. Approaching the squat rack in the anatomical position, pronate the hands, placing them a little wider than shoulder width apart. This is a personal preference, but I like to place my thumbs along the knurls of the barbell. The body moves under the bar, resting it anteriorly in the pocket above the clavicle. Feet are shoulder width apart. Hands begin gripping the bar in a supinated position, then fully grip with the semi-prone position. Walk the bar forward a few steps, take a deep breath to stay tight, and begin the squat. Flexing from the patella joint, the legs should begin to move proximally to the floor and the ankle joint undergoes dorsiflexion. Once hitting below parallel, begin plantar flexing from the ankle joint and flexing from the patella joint to stand back up. Once standing erect, walk the bar back to the rack. Next is the barbell deadlift. This occurs on the horizontal axis and the medial plane. Walking up to the bar, feet should be under and shoulder width apart in the anatomical position. Hands grip the bar in a pronated position. The head and chest are up and looking forward, and your core stays tight. You're pulling the bar up, keeping the bar path as close to your body as possible with no rounding of the back. You're extending your legs from the knees to stand back up, moving bar proximally towards the hips and distally from the ground. Once the back is straight and the arms are locked out, knees begin to bend through flexion and the bar is lowered back down, keeping the body tight and straight. Next are dumbbell lunges, which occur on the horizontal axis and the medial plane. Beginning in the anatomical position, rotate the hands medially. Flexing at the patella joint, moving downwards, grip the dumbbells in each hand, place shoulder width apart on each side. Gripping the dumbbells, extend at the patella joint to stand back up. Move one leg out anteriorly and the other out posteriorly, slightly bending at the patella joint. The anterior leg will stay relatively stable for the movement. The posterior leg flexes at the patella joint until the kneecap reaches the ground. To come back to the starting position, the patella joint is extended. Dumbbell goblet squats mainly occur on the horizontal axis and the medial plane. Approaching the dumbbell in the anatomical position, flex at the knee joint to pick up the dumbbell. Once at floor level, grab the head of the dumbbell on either side with your hands in a supinated position. Keep the dumbbell in a front rack position, medial to the midline, with your chest tight and upright. To squat, flex your legs in the knee joint and let the dumbbell path travel between your legs. Once you've reached the bottom of the squat, your butt will hit below parallel. Push-ups occur on the horizontal axis and the medial plane. Begin the push-up in a high plank in the prone position. Looking at the ground, the anterior of the body should be proximal to the hands. Toes should be planted on the ground with a slight dorsiflexion. Your back and core should remain straight with the power coming from your arms, flexing at both elbow joints until your chest reaches the floor. Once at depth, extend from the elbow joint to come back to the starting prone position. Lateral raises occur on the anterior-posterior axis and the medial plane. This is an abduction-adduction movement. Grab the dumbbells with your hands medially rotated. Begin abducting the arms on both sides. You've gone far enough once you reach a T-pose position. Gently adduct both arms back medially to the midline. The barbell strict press occurs on the horizontal axis and the frontal plane. It is a flexion-extension movement. The barbell should be resting in the front rack position, elbows anteriorly up and out, with the hands gripping the bar in a semi-supinated position. Begin extending the arms from the elbow joint. As the bar path begins to pass your head, protract the mandible to push the chest through the movement and lock out your arms. To come back down to the front rack position, flex at the elbow joints and land in the starting position. The bench press occurs on a horizontal axis and the medial plane. Begin the bench press lying in the supine position. Both hands should be reaching out for the bar anterior to the chest. Hands should grip the bar shoulder width apart or further depending on how you like to grip it. Unrack the bar. Holding the bar, flex at the elbow joint, bringing the bar proximally towards the chest. Once hitting depth, extend the elbow joint, bringing the bar back distally from the chest.